everyone. Thanks for joining us. This is Sipping Tea with Nat and Z. I'm Nat.
And I'm Z.
Welcome.
Yep.
What's going on, Z? What's going on? It sounds like a loaded question.
Man.
if y'all can see her face.
It's just been, let's just say it's been a week. Now that, if you listen to the last episode, I've been recently diagnosed with PCOS. So I'm on some medication now, and this medication is really just, it's an adjustment. So I'm adjusting to that, in addition to having some dental surgery recently.
Yeah, on top of that, all up in the head area. Not a good look.
I am over it. You hear me? I'm over it. So...
Understood.
But how have you been?
Pretty much the same. Like we're talking about that we both feel like we just falling apart.
Mm-hmm.
With every little day that goes by, something is hurting or aching. And like I'm congested and then woke up, back hurt. Shit like that.
Welcome to your 40s, bitches.
Yes, enjoy. And this is mid-40s. This is the mid-40s stuff that people don't tell you about.
Oh, I don't even like that. Mid-40s.
Unless you J-Lo and you have a personal trainer looking amazing at 50, but whatever.
Hey.
There's that.
But I got a personal trainer now, and I'm trying to look like, and I'm not trying to look like J-Lo at 50. I'm at least trying to look like Claire Huxtable.
You trying to look like Claire Huxtable at 50? Those are good goals, because when she was in her dance class with her sister and she was trying to get into that dress.
Yes. That's how I'm trying. Wait, and you know why I said that? Because I was watching an episode of The Cosbys recently, and it was her birthday. It was Claire's birthday. And she was 46. And I looked at her and I'm like, ain't no way. But she really was 46. And I'm just like, is that what I look like?
At 46?
Like, at 46? And then they were clowning her. They were like, yeah, how is being 46, Mom? And she's like, fine. And Vanessa was like, whoo, because Carol's mom said she was okay with 45 because she was still close to 40. But 46, now she's close to 50. And she almost had an emotional breakdown.
Was that one of her moms that's friends with one of her friends that went on...
with the Wretched?
With the Wretched?
It might have been.
To have big fun
with the Wretched.
Big fun with the Wretched.
Oh, Lord. But this is good that we're talking about that, because this whole episode is about the journey to motherhood.
Yes.
And I think some of my first, ideas of what motherhood could look like outside of what my reality was the Huxtables.
Yeah.
And Claire.
Fair enough. So, what we got going on today with the tea of the day?
So, disclaimer.
Mm-hmm.
I'm going to just keep it short. Don't be drinking no tea, mixing it with medication, and not talk to your doctor, okay?
And there you have it, folks. There you have it, okay? So don't come back to us and say, Nancy told us to drink some herbal tea with our medication, and now we just all the way jacked up.
Because Nancy ain't tell you nothing. Because as you can see, we barely keeping it together ourselves.
We are holding on for dear life today, y'all. So don't come back and say that we told y'all to do any of that stuff. Please and thank you.
Because I smooth forgot to ask my doctor about mixing my medication with tea. So...
Yeah, well, I'm sure you are among the majority with that, because most people don't think about that stuff.
Yes, we don't.
At all. At all, because tea fixes everything.
Yes.
As far as we're concerned in our culture.
Yes, tea and ginger ale.
Yes, tea and ginger ale fix everything. So, the tea on the table today is called Beautiful Wonder Mint by Grace and Gratitude, which is a Black woman-owned tea company.
I like that name, Grace and Gratitude.
Isn't it beautiful? And they have, we're going to include the website too for y'all. This is a neighbor of mine, Candace Brown, and she started this a little bit after her second child. And I think it's definitely a tea company you want to check out. But the tea itself, it's not your average mint tea. It has spearmint and peppermint, with some fruit and floral notes. The tea is soothing as much. I am drinking a cup right now. I had some last week. It's quite tasty. So yeah, definitely check it out. Her company stems from her love of high quality teas, holistic wellness, cultivating connections with fellow wives, moms, and busy women. And she believes, as do we, that the overall wellness can start with a cup of tea, and has, as we've said, health benefits and stuff like that. But she started this tea to complement women's journey into their wellness and self-care, which dovetails really nicely with our show.
Yes.
So definitely check it out. It's graceandgratitudeteas.com, and we'll have that information for you on the website and on IG. So you can check it out.
All our
so what's
social
going on
medias.
Yes, all our social media handles. So what's going on with the hot tea?
So let me tell you, like I said, this medication just ain't sitting well with me. So my preparation for this has been light.
It's been a bit light.
It's been a bit light. But let's see. So we are getting the next versus battle. One that I am particularly excited about, which is Ghostface and Raekwon. Of the Wu-Tang Clan. And this will be on March the 20th. Yes.
Wu-Tang?
You know,
Wu-Tang.
I haven't. Yes.
No, they ain't nothing to with.
Exactly. You know, I have an affinity for Wu-Tang. I used to live in Shaolin. For a time.
Whenever we went to go visit Zarifa, we were like, where are we going? Shaolin?
Shaolin, yes, and y'all did.
Yes.
For those of you who are not in the know, that's Staten Island. In my law school days, I lived in Staten Island, so I'm really looking forward to this, and I can't wait for ice cream because, like, that is probably one of my favorites. And I don't know who gets to do it because it's both their songs, so I'm just really looking forward to this. And Versus actually sold their stake. Well, Timberland and Swiss Beats sold their stake in Versus to, I think it's called Triller. And the good thing about this is a lot of people were like, oh, we can't ever keep stuff. We're still keeping it, but we're sharing the wealth. Right. So they're able to, from the sale of the stake of Versus, they're actually able to pay the artists who have performed thus far. So they get a cut of the sale of it. So I think that was pretty good. You know what I mean? I think that's pretty dope.
It's a nice way that worked out.
Yes, and I think both Swiss and Timberland are on the board of Triller now or something to that effect, and they're going to help build content and stuff like that. So I think it's a good look.
It's money moves.
Yeah.
Money moves. That's looking at the 30,000-foot view.
Yes. The Grammys are this weekend. That's all I got.
That's right, they are.
You know, oh, yes, before going back, Jay-Z and Tidal, to dovetail off of Versus, Jay-Z actually sold a huge stake of Tidal to Square, which is a Jack Dorsey, I think his name, who owns Twitter. I don't know if he still owns Twitter, but he was a founder of Twitter. And I don't know if you had been seeing pictures of Jay-Z and him on the beach in Hawaii, and people are like, what is Jay-Z doing with this white man? Well, that's what he was doing, making big money moves, okay?
Oh, wow.
And there are each artist that were stakeholders in the original, I would say, Tidal. Founding of Tidal, each get like $8 million. So that's like Usher, Rihanna, Nicki Minaj, Beyonce, I think T.I., which we're going to get to a little later. So that's money in the bank.
Okay.
Black men doing big things, and I ain't mad at it. And then, going back to the Grammys, that's all I got. I mean, I might watch it just to see Megan Thee Stallion perform, but the Grammys just came out and said that Beyonce was not performing. And so because of that, I was like, because I thought she was going to perform with Megan.
Performing?
Well, I thought she was going to perform with Megan Thee Stallion.
Right. To do
Savage.
Savage.
But apparently that's not happening. And so now Megan is performing with Cardi B, with WAP. So I may watch that.
Oh, okay. They're going to make that television friendly? Do people watch it?
I don't know how they're going to make that television friendly.
I don't see how that's kid friendly. With WAP. Just saying.
I don't know. I mean, I don't know. just like, award ceremonies as of late, I'm not really excited about it.
Mm-hmm.
And not so much because of COVID and the different ways they have to, push this media out to us. It's just like, but it does bring me to, so there was a song that was released last week called I'm gonna leave the door open.
Yay.
And it is with Bruno Mars and Anderson .Paak. And I heard that they were doing a joint venture a while ago. And this song is the first release from that joint venture. And they're supposed to also be performing at the Grammys. So I'll probably tune in for that as well. But other than those two performances, I really am uninterested in the Grammys. So
yeah, I don't remember when you say something.
Yeah.
Like when you talk about it. Otherwise, I will completely forget that they're on.
Yeah, I'm not. Only thing award ceremony-ish that I'm looking forward to is March the 15th, where we will have the nominations for the Oscars. So I'm really looking forward to that.
March.
Yeah, I'm looking forward to that.
Okay, cool.
If you are on the social medias, you've seen a meme going viral over the stimulus check. And Joe Biden has now been officially dubbed Moneybag Joe. I think he was on.
A meme?
Yes, they have him.
I have not been on social media.
They have him dressed like 2 Chainz with a stack of money to his ear, like it's a money phone.
Lord, Moneybag Joe.
He's where the money resides.
What? At least they didn't do that where the money resides. I don't know which is right.
They may have. I didn't see that one, but they called that man Moneybag Joe. It was so viral that it was on, I forgot, CNN or MSNBC. There's this guy. Yeah, there's this, I forgot what his name is. It'll come to me. But there's this anchor who always is using pop culture references.
Ari Melber?
Yes.
I love Ari.
I love him.
That's my boo.
And he's always using pop culture references. He always uses like rap lyrics. Biggie, Jay-Z, Nas. I've heard him say a lot of people's verses. Yes. So he actually talked about it, and it was hilarious. He actually even showed some of the memes. He said, yes, there's this one meme with Joe Biden dressed as one of these entertainers, flashing off his ostentatious wealth. So, yeah.
That was for the culture, y'all.
For the culture. And for y'all who get the stimmy, because I don't.
Yeah, me either.
I don't know what that is. I'm sorry.
I've heard about them. No.
I heard it's nice
no stimmies over here
to pop up into your account. Unfortunately, no stimmies over here.
The money does not reside in that regard over here. But we are blessed in other ways, but in that regard, the money does not reside.
No, it does not. So I was not going to touch this, but I am going to touch it because T.I. and Tiny are in some deep SHIT right now.
Really?
Yes. And the only reason why I wasn't going to touch it wasn't because I didn't believe the women. It was too early. And I was waiting to see what all transpired from this.
Right.
There are a lot of women who are coming forward saying that T.I. and Tiny sexually abused them in ways that you would find people who have money and power sexually abuse those women who are in situations where people think that they can do that to them in. And what I mean is like these are young women who probably, have left their home for big dreams in Atlanta or LA. Some of these women are strippers. Some of them, wanted to make it in the industry of entertainment. Right. There were drugs involved, apparently. Some women felt that they were coerced into taking it. Oh. And that they did things to them that they wouldn't have consented to had they been in their right mind. There are some women who have shared their story but do not want to be named and don't want to be a part of the legal process that is currently taking place. There are people who have talked to these women who aren't closely related to T.I. and Tiny. Meaning Tiny had a friend that it was no longer her friend that actually broke this wide open. Excuse
Oh,
me.
wow.
And so I've started to see people that I respect talk about this situation and indicate that they have talked to these women and they believe these women.
Oh.
And it's unfortunate. And the women don't want to come forward because of their lifestyle. And they feel that people are going to blame them for some of the choices that they made. And it's unfortunate. They've been losing endorsements. T.I. was supposed to be in Ant-Man 3. Apparently, they pulled him from that. And, you know, I see a lot of people being silent on this. And I don't understand if it's because there's also Tiny involved in it. But I feel like we're going to see a larger fallout from this. There probably were more stars. I mean, I'm using that word loosely. Because this is Atlanta, so you use stars as you wish.
Woo! Got kind of dark over here.
Yes. So I just pray that these women get healing and therapy. And I hope that we hold more celebrities accountable for their actions. Just because you're rich, just because you have money and access to things, does not mean that you need to take advantage of those who do not.
Exactly.
Period.
Exactly.
Period.
Agreed.
I don't care if you're white, black, orange, green. I don't care if you're heterosexual, homosexual. I don't care. It's wrong.
Agreed.
It's wrong.
On multiple levels.
It's wrong. So if we take it down the Epsteins, we have to take down the Tinys and the T.I.s. I'm sorry.
Yeah.
If we're taking down the Weinsteins, we have to take down the R. Kellys. You just have to.
Yeah, it's true.
You know?
True.
And, you know, our whole platform is that we are here as a safe space to discuss issues that affects women, particularly women of color, especially black women.
Yes. And how disenfranchised we are in so many different arenas.
And so we're always going to stand with women. So take that for what you want. And then the last, which is another thing, standing for black women. This Meghan Markle Prince Harry interview.
Ooh, Lord.
I really thought, and maybe this is me being naive. I really thought that once the UK saw this interview, that maybe the tides would change a little bit in the perception of Meghan Markle and Prince Harry. And it literally did the opposite. And people dislike her even more. And dislike Prince Harry even more. And I almost feel like this is about to start World War III. Because the Americans are fully in support of these two.
Yes.
And the UK is like, y'all can go to hell.
Basically. Because they're in their bubble. They're in their whole little world. They don't know or acknowledge. I mean, Harry was like, I didn't even know how to do half the stuff to be out and about because we didn't understand what that is.
Right.
When he talked about race, he's like, "What? There's no black people in the royal family."
Well,
like, you know what I mean.
There are, but they just
exactly. They're not
right
out there. Yeah.
I feel like I feel like the world as a whole has embraced Meghan. I think it's just the UK is just taking a long time to get on board. And I think that the rest of the world is in support of her because of how the monarch has come in and basically shit
on everybody
in a lot of these countries. You know what I mean? Well, England, not the UK.
Okay.
So, Meghan said that somebody asked about the skin color of the baby when it was going to be born.
Archie.
And Oprah hit her with the Porsche. Who said that? Who has said that?
What?
Who has said that?
Now, Oprah, you know they're not going to tell you.
No.
Come on, but I mean, I know you had to ask.
It's either Prince Charles or Prince William. And somebody said it's probably Prince William, and that's why he lost his hair. Because God don't like ugly. That's why he bald.
Well, you heard how they said that she made Kate cry and it was the other way around?
It was the other way around. You know, you have her asking to have her mental health supported. They're like, nah, you're on your own. You figure it out.
Mm-hmm. But they have a mental health organization?
Hello. And the one thing that struck me that really made me realize, wow, Black women, it just is across the board. We will protect everybody else to the detriment of ourselves. And this is important when we're talking about the journey of motherhood. Sis really said when they told her that they weren't giving her son a title, therefore he did not deserve protection, and she wasn't getting protection, and Harry wasn't getting protection, she literally wrote the royal family, the institution, the firm, and said,
yes,
please, I understand that my son is not going to get protection and that protection is not going to be afforded to me, but please, whatever you do, protect my husband.
Yes.
Like, this is what Black women do.
He's a prince. He's supposed to be protected, is he not?
They said, you with that woman, you on your own. And that's sad, and that's telling. And again, I hope here where they are that they do have a great support system, a great network of people who uplift them and make them feel happy and secure, because this is history repeating itself.
Exactly. He made sure to make it the point of that. He's like, I'm watching this happen all over again.
Right, with his mother. And I saw something where they were comparing and contrasting some of the things that Diana said, that Meghan said, and I'm like, how is England not seeing that this is the same? That this is exactly the same. So I'll leave that. I'm going to leave this here with 3 things. Protect Tyler Perry at all costs. I mean, his movies could go to trash, but protect him at all costs, because he gave them protection. He gave them a home to live in. So let's protect and uplift Tyler Perry at all costs.
Thank you.
I'm about to say an explicit term, so forgive me. Fuck Sharon Osbourne and fuck Piers Morgan. And I'm out.
Oh, wait, what happened with Sharon? I know Piers Morgan was on some other shit, but
so Piers Morgan saying all that he said, coming to find out that he really was just jaded because Meghan ghosted him for Harry. Yes. Sharon Osbourne started caping for him.
Oh, really?
And was like, oh, he's my friend and he should be able to speak his truth.
His truth? But you're on a show with all women where you talk about women issues. Are you not?
That's why I said Sharon Osbourne. I don't even want to give her any. If you want to see it, go. It's all over the internet. And what's her name? The Zeta, Cheryl Underwood.
Yeah.
Calmly tried to explain to her why caping for Piers was wrong and how it appeared racist. And Cheryl did it in the ways that Black women always have to have these difficult conversations with people who don't look like us. We have to be demure and non-aggressive. We have to watch our tone and our hand movements. Meanwhile, Sharon popping off, pointing fingers, flaring up. But if we were to do that, and why is it our job to educate a racist? It's not.
Always.
But it always is landed on our shoulders. So that's why I said what I said and whatever. And that's
what I said.
So we can go ahead and take a quick break. And be back with our tea time.
All right now. And we are back. So, like we had mentioned earlier, this episode is about our journey into motherhood with a focus on Black women and their journey. And like we alluded to earlier, all the different things that we have to go through to get to this point in our life. So, speaking of that, so when Black women who experience pregnancy in the U.S. Often encounter, and we talked about this last week in our women's health, multiple levels of oppression. Unfortunately, our risk for dying from pregnancy complications is 3 times higher than white women, according to the CDC. They're more likely to give birth to low birth weights of infants and have newborns who experience higher infant death rate. That's concerning on so many levels.
It really is.
I mean, it's the fact that Black women are also twice as likely as white women to experience infertility, which we touched upon last week with some of the reproductive health issues and less likely to talk about it, which, as we mentioned before, that's a conversation, Z, that we definitely need to make sure we breach with other women to have these conversations because there's too much stigma and shame attached to that.
Yep.
And it's definitely something that needs to be talked about because we need to make sure that everybody is educated about the differences in these maternal health outcomes, understanding that socioeconomic status doesn't explain these negative pregnancy-related health experiences either. No matter where you are in the socioeconomic ladder, these outcomes are still the same across the board for Black women. And this can be, I guess pretty much attributed to various systems of oppression, such as institutionalized racism, gendered racism, and intersectionality. And or intersectionality. And we got to look at how do we provide a context for why these experiences are happening to us as Black women repeatedly and consistently for years on end. And we hardly ever talk about the trauma that comes along with this of trying to conceive and during pregnancy and after giving birth. This is, both of us have experienced this in some way, shape, or form as far as having issues and challenges conceiving or not being able to conceive in my situation, or challenges getting to that point, including age. And then underlying health issues that were not discussed. You know what I mean? So there's just so many different things that fall into that. But there's some areas to kind of think about before you even get into the whole pregnancy realm. Consult with your doctor. And I say this after you've advocated for yourself, you and your doctor have established some sort of relationship so you feel comfortable having these conversations. And, get a preconception checkup. Have your breasts, lungs, hearts, blood checked, all of that, genetic testing. If you know this is something that you want to go into and you're of a particular age, pretty much, I guess, science says after 35. But, a lot of us are having babies later in life, in our 40s. So we sometimes wait till get all of this stuff taken care of after 35.
Right.
But definitely look into it before then.
Oh, let me say something really quickly that just pops it. Well, it was something that I wanted to make sure that we preface. A lot of our listeners may be past the childbearing stage, not just necessarily due to age, more so because they're like, look, these little suckers is expensive. I ain't trying to have no more, right?
Right.
Some of us are past the childbearing age just because of how old we are. I just want to preface that this episode, it may not pertain to you specifically, but a lot of us have daughters, we have nieces, we have cousins, we have women in our lives that may be considering getting pregnant.
Yep.
Thinking about getting pregnant, having issues getting pregnant. And I think it's important that we share this information with everyone. Because if you are still thinking of having children, I think a lot of this information is going to be very useful to you. If you aren't thinking of having any more children, there may be someone in your life that you could pass this information on to, or point them to this episode and say, hey, you know what? Listen to this, because there are a lot of things that I've learned during the research of this that I'm going to make sure that when my daughter gets of age, there are certain things that I'm just going to be hyper proactive about because these things weren't hyper proactive with me. So I just wanted to put that out there.
Yeah, it makes sense, because this is, of course, like we said, it's Women's History Month, but we all know someone that this information could, help out in some way, shape, or form. Speaking to getting the physicals, like we said, get all of those things checked on a regular basis, which is also attributed to the Women's Health episode. Making sure you do that. Cleaning out your gut.
Ooh, yes.
Certain food, this is a big one. Certain foods cause inflammation in the digestive system, leading to acne, stomach aches, hormone imbalance, and infertility. There's so many resources out there that you really need to think about looking up what your body needs to be in, what type of shape it needs to be in before you decide to even enter into this world of having children. And if you smoke, stop. It's been proven that it takes longer to conceive from non-smokers, and they tend to have infertility problems. Even women who are exposed to secondhand smoke are at risk. So something to definitely think about. And we all know the effects of secondhand smoke over the past years of different studies and whatnot. Folic acid is huge and extremely important. This is a vitamin you should definitely start taking, prenatal vitamins. They just help with your hair, skin, nails, just to kind of keep your body in optimal tip-top shape to be able to receive and be able to carry if that's what you choose to do. Healthy food choices, getting rid of junk food. We know that's like really hard because it's so good, but it's good because it has fillers and preservatives and sugar and sodium and man-made glucose, fructose, whatever the commercials be talking about that you're not supposed to be doing. Incorporate more raw foods, more fruits, veggies, and healthy fats like avocados and stuff. Get your avocado toast thing on. And more natural cleaning products around the house because the fumes do have an effect on you after constant exposure. Definitely keep that in mind. And getting your dentist appointment, so much of your health is tied to your oral health because of so much that your mouth
you have
is
no
exposed
idea.
to.
Yes.
So many things. Like, it's kind of astonishing how much of your health between your mouth and your gut, those two things contribute to your overall health in so many different ways.
Yep.
This is a big one that Z and I talked about last week while we were brainstorming. Knowing your family history. Now, this we understand can be a bit challenging for those of us in the Black community.
Yes.
Because folks don't like to talk about their business.
Yes.
To our detriment, oftentimes.
Yes, to our detriment.
So, and knowing, if your parents or your mom or your dad have particular pre-existing issues, like we said with sickle cell. I found out, when I was in the hospital, I have a heart murmur. Then I was like, kind of taken aback. And my mom was like, oh, yeah, we have that. I'm like, well, did you think you could tell us maybe? So I didn't have to find out in ICU.
Girl.
So stuff, I'm just stuff like that,
Yes.
know?
Trust me, my grandmother, when we took over care of my grandmother, when she started getting dementia, when we had to like physically bathe her and stuff like that, we didn't know she had a mastectomy.
That's crazy.
And my grandma was literally in her 80s, and we did not
Wow.
know. And I don't know. We don't know when this occurred.
Happened.
We don't. And that was definitely information we could have used, being as though my mom died of breast cancer.
Yes.
My aunt, my great aunt on my mom's side had breast cancer. Like, that was information we probably should have known. That she withheld. So like, let's not do that. Let's not do that anymore.
Exactly. And then like even with fibroids and fertility,
yes,
have those and it causes infertility issues. You know what I mean? I don't know. My parents, when I was going through my endo stuff, they're like, yeah, we've always had bad cramps. But had I known earlier, then I would have taken the issues. I would have looked at it a lot differently.
Yes.
I would have frozen my eggs because I couldn't retrieve them and then find out I'm infertile. Like, those conversations need to be had.
Yes.
In some way, shape, or form.
Yes.
And if you've had miscarriages or if there's any other pre-existing situation within your family that will affect your journey to motherhood.
Yes.
It is so
It's so important. And this is definitely important for those of you who do have children who are, of age to start thinking about having kids. This is information you are going to want to share with them. Please share it with them. Don't keep it to yourself because it's not doing anybody any good.
No.
And it actually can be helpful and useful.
Very much so. Very much so. And that goes hand in hand with your insurance coverage. Because if you need to go to the doctor to find these things out or to a clinic, please do so. But definitely check your insurance. What's covered, what's not covered, because a lot of times a lot of insurance companies don't cover as much maternal care as you think. And it's a little too late by the time you figure that out. And then how long is your hospital stay for vaginal birth versus C-section? Because in this country, they just like ramp you out. Like, oh my goodness, there go the baby, time to go. It's like 2 days or something like that.
Yep.
Something crazy.
I know for a C-section, it's 3 days. I got to stay an extra day because I was having complications due to preeclampsia, which we'll get into. But so I was able to stay an extra day. But thankfully, my insurance covered that extra day. But that's what I'm saying. You have to make sure that you know what your health insurance coverage is, because if you're trying to get pregnant, you're going to want to know what's covered. Yes. Because that may make you change maybe your health insurance coverage to get more.
Exactly.
Thankfully, my health coverage covered everything. I didn't have to pay for anything. I actually just got a
wonderful.
check like 3 months ago
Uh-huh.
for services that I paid for that I shouldn't have paid for, and they
Oh,
gave me my
wow.
money back from when I had my child. And she's a whole smooth ass 3 years old.
As of last week. As of last week Monday, she's 3.
So just make sure you're on top of your health coverage.
Yes, and what your employers offer as well, because definitely ask around, because if you, I know my sister, when she had my nephew in Hong Kong, she could stay there for like a week and it was only $10 a day, but that's universal health care for you. So I mean, and they made sure that the baby latched for everything before they let them go. Like, it was not we're trying to hurry up and rush you out.
Right.
So American healthcare system, well,
Trash.
Lord help us. And this, of course, all goes in concert with reducing your stress, whatever that may involve. You need to figure out, because stress has an adverse effect on your fertility, on your psyche, on your sleep patterns, on how you digest food. How, when my sister was trying to get pregnant, they were stressing about it so much. And then once they relaxed and decided not to, they were able to get pregnant. On the other side, my other girlfriends who have done IVF, it took them years and a lot of money, but we'll get into that in a little bit.
Yes.
But yeah, going on to what else can happen those are some things to look at before you decide to try to have, this journey into motherhood and stuff.
Right. And if you are blessed to be able to get pregnant and carry a child, there are a lot of things that we need to think about and take care of and advocate for during our pregnancy. Because, like it or not, there still are racial disparities and risk factors related to pregnancy, right? There's hypertension, there's anemia, there's gestational diabetes. And these things are exacerbated by stress. And a lot of stress is related to racial inequality. So you're like, it's a double-edged sword, right? And a lot of times there's inadequate health care.
Yep.
And it's not in tune. The health care that is available is not in tune with African American women's needs, right? We are still 3 to 4 times more likely to experience a pregnancy-related death than white women. Black women's heightened risk of pregnancy-related death spans income and education levels. You can look at Serena and Beyonce's birth stories as examples of that. We are more likely to experience complications throughout the course of our pregnancy than white women. We are 3 times more likely to have fibroids, which is something we talked about last week in our last episode. And we experience physical weathering. And I didn't know, this astounded me. I was like, wow, this is true. And that means our bodies age faster. So black don't crack on the outside. But like me and Natalie tell you, our insides is all falling up. We might look good, but the inside is what the issue is. So, what can you do? What can you do to kind of advocate for yourself, right? What can you do? Choose black care providers.
If at all possible.
Yeah, if at all possible.
There's apps for that, which
yes.
also post.
Yes.
Hue and Her Health.
Yes.
Health and Her Hue. Something.
And this is to help protect you in your pregnancy, right? And the black health care providers could be OBGYNs, doulas and midwife, a maternal fetal medicine specialist, which is something I had to have during my pregnancy. And they basically focus on medical management of high-risk pregnancies. And if you do this, it can, and these are things that we talked about in our last episode, decrease implicit bias, increase patient satisfaction, improve medical decision-making, and increase patient-provider communication and patient-centered communication. Another thing you can do is share your fears with your care provider, right? Look at the statistics about race and its impact on maternal care and ask your care provider, I've recently read that black women like me, we sometimes have a much higher chance of death related to pregnancy and childbirth. That really scares me. What do you think about these statistics and how can we work together to prevent that from happening? It's an important question to ask. Now, as Natalie said, there are sometimes, depending on the areas that we're in, we're unable to find black care providers in our area. So if you're unable to find a black care provider in your area, create a care plan anticipating unfortunately, that racism may impact pregnancy. So this may just entail you for some appointments, bring a support person along with you, hire a birth doula to accompany you to feel safe and supported.
Yeah, so important. That can be
Yes.
so enveloping. A lot of folks that I know, a couple of my girlfriends have had doulas, and it's provided that extra little bit of support that they needed, that the clinical side of the obstetrician just did not offer for
Right.
whatever reason, because of their bedside manner or not, or just because it was just too rote and clinical.
Exactly. Um, we've talked about this a few times already. You're going to want to alleviate your daily stress. Again, like there's research out there, folks, that show that systemic racism can manifest itself into physical ailments,
Mm-hmm.
hypertension, higher rates of heart disease. And
Mm-hmm.
you know, this is
That's post
something.
traumatic stress.
Yes. And this is something as Black women we really need to pay attention to when we are pregnant, because we can develop heart disease related complications like high blood pressure and preeclampsia. And preeclampsia is a high blood pressure related disease that only occurs during pregnancy. I had preeclampsia. I wind up having my daughter at 35 weeks. We are 3 times more likely to die from preeclampsia than white women are. Beyonce actually had preeclampsia as well. Can cause, in most cases, preterm delivery and labor. That was my experience. And I'll tell you this, it's not fun. It's not fun. Like, I literally went in to have my regular normal checkup with my maternal fetal medicine specialist.
Mm-hmm.
I went in, my appointment was at 9 o'clock. They sent me over to labor and delivery at 9:30 to get
Mm-hmm.
monitored. I called who was my fiance at the time. I called him. Well, no, we were engaged then, but that's neither here.
Y'all was together.
We was
Okay?
together.
Y'all
That's
was
what you need to know.
together.
We was together. I called him and I was like, hey, and I'm just sharing the story so you understand how quickly things can go
Yes.
downhill. I was like, hey, they're sending me over to labor and delivery for monitoring. Just put my bag in the car. You might, come over. I doubt I'm going to have her today, but, just bring my bag just in case. He's like, all right, cool. I literally called him maybe like 20 minutes later and was like, yeah, they're taking her today. He's like, huh? I was like, yeah, I
Mm-hmm.
have to have her today. And thankfully, the doctor that I saw, the maternal and fetal specialist clinic, she looked at all my past ultrasounds, noticed that Charlie was in distress,
Mm-hmm.
and said, no, you have to have her today. I called my friends. They came. Natalie was the last one in the room. And as Natalie and I were talking, the doctor came in and was like, they had scheduled me now. They was like, okay, you're going to have her today. We're going to give you a C-section later on in the evening. I was like,
Right.
okay, cool. Natalie came in. We're talking. They came in. It's like, oh, yeah, no, we're actually taking you now. I was
Like
like,
right now. So say bye.
yeah,
And you're going to have to go out in the waiting room.
yes.
Okay. Okay. I'll be outside.
And thankfully, my husband got there in enough time, because by the
Yeah.
time he got there and they got him dressed, it was like showtime.
Yeah.
And I had her at 3:30.
Mm-hmm.
I'm saying all this to say you need to be an advocate for your health. Pay
Yes.
attention to your body because you know it the most. And if something is wrong, speak up.
Please,
Speak up.
please speak up. Question.
Yes.
Question it.
Because the blood pressure thing, that's why I had to stay in the hospital longer. What I didn't know is that preeclampsia can occur even 10 to 426 days postpartum. So it could still happen. So I had to monitor my blood pressure after. I had to be on blood pressure medication for a month just to make sure everything went back to normal.
Yep.
So you need to ask the question. I know that Black women like me are more likely to have problems related to blood pressure and pregnancy. How are we going to monitor my blood pressure so that I'm safe? You're going to want to identify how racism may impact labor. Okay,
And
there
it
are,
can and does.
yes, for some reason they think we have higher pain tolerances, which leads to disparity in pain management. Okay,
Yes, that is so
so
true. On not just this, on so many other levels
so
when it
many
comes to our
levels.
pain management.
A lot of this goes back to the history of slavery and how it impacts the treatment that we receive.
Yes.
So just be mindful of that. There are questions that you can ask. Research has shown that Black women are more likely to have their pain undertreated. I'm worried about being in pain and not receiving appropriate treatment. How can I make sure that that doesn't happen? Okay.
That is real. Ask those questions.
We are at higher rates of receiving cesarean C-sections the first time. If you're not clear, if this is what's happening to you, you have to get a C-section. That's what your doctor tells you. Ask questions.
Always.
Why do I need to get a C-section?
Is it because it makes it
It's easier for you?
Or what? Because it's not convenient for me.
Right. What is your cesarean delivery rate? Why would you advise me to have one? Okay. You're going to want to have a lot of these things, these questions asked. You're going to want a lot to be thinking about these things during your pregnancy. Take a birth class, right? Try to see if you can find a birth class that caters more to the experiences that Black women have during labor and delivery. And, create a birth plan, a birth preference document. I will tell you, create it, but be flexible. Because I had a whole birth plan in place and that shit went out the window. Nothing on my birth plan I was able to do. Nothing. So just be mindful that things may have to adjust, but don't just accept it because that's what they say. Exactly. I knew because my child was in distress. So I didn't fight that because her life was more important in that moment than my preferences.
And it's important to know that, to have the backup, but understand it has to change. And going into that can create a little less stress.
Right.
Because if you're too hell-bent on it, that can just throw your stress level on top of everything else and create so much more distress.
Right.
For all parties. Creating the birth preference document, I think, is genius. And it flows into where you can do that with a postpartum preference plan as well. So with the postpartum and postnatal period, it's critically important, and it's unfortunately often overlooked. Up to 45% of maternal deaths happen within weeks after delivery, a time when you're pretty much removed from medical care. One of our girlfriends said from when she had the baby until she saw the doctor next, it was like 6 weeks or 7 weeks, 7 weeks, 6. It's crazy. Like, so there's certain things that are going to be overlooked, unfortunately, which is why so many women are lost during that time.
Yep.
Which is just try to wrap your head around that. In the United States, postpartum period is commonly thought of as 6 weeks after delivery, but due to insurance changes, that can vary. So that's why the whole insurance comment we made earlier is so important. And this care should be beyond medical. It has to include your physiological and psychological care as well.
Oh,
yes. A lot of stuff that you're going to be going through, and and it should be part and parcel of your plan anyway. But unfortunately, it doesn't appear that is unfortunately not included.
Right.
So you definitely have to be mindful of that. And if you do decide to do a postpartum preference plan, it should include in discussions about support teams, preferences, like do you want to be breastfed on demand overnight or have someone help with the nighttime feedings or plan check-ins with your care provider. Some of those things you definitely need to delineate, because I know Zarifa experience was different, and my sister lived in another country, and they came in and like automatically did the breastfeeding. Like literally my sister would sleep, take her boob out of her gown and attach it to my nephew's mouth, and then they sit there and watch and wait until the baby latch. It doesn't always happen here in the States to encourage breastfeeding.
No.
And
I had challenges with the breastfeeding just because she was so early. She couldn't be in the room with me because she was in the NICU. Right. So I had to go upstairs. And that's painful when you just have a C-section. Get up, out the bed, go up to the NICU floor, breastfeed, pump. It was a lot. And my mental health was just like
I was about to say,
trash.
what was your mental health? How did they even address that? Because the stress of having the baby early, her being in a NICU, that's in and of itself, birthing is stressful. And now you have that to worry about.
It was trash. And I can admit that because I'm one of those people who, like, my husband, he said this about me during the time when we knew she had to be delivered early. I went into robot mode. And that's generally what happens when something stressful happens, like the death of my grandmama. I went into robot mode. When they told me I had to have her early, I went into robot mode. I was like, it's almost like non-emotional. I shut down because I cannot let the emotions take over. So I literally get into a very sterile, like, okay, this is what needs to be done. We will do this. It's like Stepford Wife. Like, okay, I understand. Let's get this done. And it was like, I was like emotionless. And it's not that I don't have emotions. I just have to pack them up for that moment.
It was a coping mechanism to get through what you need to get through.
Right. But I will say, I think that doing that led to me having some postpartum depression because I held those things in.
Yeah.
That after her birth, it just was like everything hit me all at once.
All at once.
My hormones were all out of the whack. I was able to breathe. I'm like, I just had this child at 35 weeks. Like, and and this took a while because she was in the NICU and I had to keep it together while she was in the NICU. She was in the NICU for 11 days. So as soon as she came home, it was just like, oh my God. Like
a wave of everything.
Yes. I think every morning when I would take a shower, I cried. I just stood in the shower and I just cried because I was just so overwhelmed.
It's a lot.
And nobody talked to me about how I felt about having my child early. Like, and when I mean nobody talked to me, I'm not saying friends. I'm not saying, I'm talking about
medical
care workers
that should have been able to step in at that point.
Nobody talked to me. I was struggling with breastfeeding. I was struggling taking care of a newborn. I'm sitting here, a new mom. I didn't know what to do. And I just was like, what the hell? I just don't know. And I would, I knew it was bad. And this is funny. When I called my friends, I don't really like to ask people for anything, but I sent a text message, a group message, and it said, I need help. Can y'all feed me? Can y'all bring me food? Something. I am like, I can't do it. I can't do it.
Yeah, it's a lot. And it's unfortunate that when you talk about postpartum depression, it's extremely common. I have no idea. I don't understand why it's not talked about more. 1 in 7 mothers have and suffer from this. Women of color and low-income mothers are several times more likely to suffer from postpartum mental illness, but less likely to receive treatment. That is so true. I did my thesis on postpartum depression, and my particular clients were of younger age, and they were of low income. And when I tell you that to talk about anything that came with postpartum, dealing with their emotions, how to take care of the baby, the breastfeeding, everything that Zarifa said, and they were younger. Unfortunately, these young ladies were between 12 and 15 that were my clients. But no matter what age across this, and they're at a particular emotional level that they're not quite developed yet to even understand what they're going through. But you figure as a grown woman going through this, and there still are not resources available.
No.
That are being injected into how do you care for.
No one talks to you about it.
It's crazy.
It's and I think that the things that people do talk to you about when we're talking about postpartum depression, it's like the little stuff. Not the little stuff. Let me rephrase that. The stuff that you just automatically assume. Trouble sleeping. Your appetite changes. There's severe fatigue. Your libido is non-existent. Your mood changes. Frequent mood changes. But there are a lot of other symptoms that typically we don't talk about that manifest themselves. And it's something that we need to address. And I think that some women, and I think I know maybe a few, that are embarrassed to
to talk about
to
it.
talk about it or feel like it's a weakness. Like, you could have a conversation with them, be careful about postpartum depression. You may have postpartum depression. Postpartum depression is real. And I'm pretty sure we've had these conversations, or we may have been the people that these conversations were had with. I'm like, oh, no. I don't have postpartum depression.
Right.
No, we don't get that. Black women don't get postpartum depression. We're
talk
too
about it.
strong. I don't have that. I'm strong.
I'm
And
gonna
it's
push through. I'm
right.
gonna muscle through it.
Because you think you know what postpartum depression is. But
And
you may
it's
not know because nobody talks to you about it.
Exactly.
So, are you having trouble concentrating and making decisions? Severe anger or crankiness? You just don't even want to bond with the baby. You're not interested in their well-being or development.
Yeah, some of those things people really need to understand that is part of postpartum, and the spouses and families and partners need to understand that as well, because culturally, this can be a detriment to women as well. Because I have friends that are from other cultures, and the in-laws are wondering what is wrong with the woman. She's like, let's just deal with it. Why are you're causing grief for your husband or for your partner? Because you see, everybody has babies, just get used to it. And it gets downplayed to the detriment of the baby and the mother. And unfortunately, it is not discussed.
And this happens a lot in our community, and I just don't understand it. And the reason why I say it happens a lot, because I've seen it with my own two eyes. People that are highly educated individuals, have, you would think, a high emotional intelligence, and you're trying to have a conversation with them about this, and they're like, what? I've literally, and I'm not lying, I've literally had someone tell me postpartum depression is for white women.
Yeah, I've heard that before.
I said, what?
It is not.
Where is...
You're here to tell you it is not, but yes, I've
literally had somebody come out their mouth and say that. Well, postpartum depression is for white women.
And that's because we don't talk about it.
Right.
Because we don't talk about it. We hear white women talk about it all the time.
Right.
That's why a lot of Lifetime movies got shows. I'm just here to tell you. Some of them movies, because somebody lost a baby and then they went crazy. I'm just letting you know. Representation matters.
No. And it can last. Longer than what you think. Years.
Up to 5 years.
Yes.
Postpartum depression can last up to and including 5 years.
We just need to, and I urge you, if you know someone who's pregnant, have this conversation with them.
Yeah.
If you see a friend who you think is struggling after having a child, have that conversation with them. If they're not receptive to it, hey, it's okay.
Tried.
But you've done your part. You know what I mean? Because there's a stigma attached to us as black women. We always have to present ourselves as strong.
And getting through.
Can't have any levels of weakness.
Woo.
And that is...
that right there.
bullshit.
Beyond.
It is bullshit. And trust me when I tell you, I am also responsible for perpetuating that lie. But I'm here to tell you.
Fast to it.
I experienced it.
Yeah.
Yep. I experienced postpartum depression. Thankfully, it didn't last long. But I experienced it. And my postpartum depression was tied into a whole bunch of things. I didn't have my mom. So I didn't have someone maternal to fall back on to help me. My grandma was gone. I just felt alone. I felt, and like most of our friends, like we say this, our tribe, it's two groups when it comes to motherhood. We have friends whose children are like, 8 and up, 6 and up. And then another group where it's like the oldest is 3 and that's my child. And, that time span is a lot. So I would ask friends who already had children certain things. I'm like, oh, I can't remember. I'll try to help you as best as I can. So you're just navigating in this world of emotion, the sea of emotion alone. And there's really no support for you to navigate through that.
As there should be. There should definitely be more support offered. And I don't know, this healthcare system is just... and that's where doulas come into play sometimes. Because they do offer some emotional support before, during, and after. Where that gap is. If you don't have friends, so to speak, that can relate to you in this particular part of your
Right.
journey. You know,
And postpartum depression is not just being sad, y'all. It's
no,
not
it is
just being
not.
sad.
It is so
It's
much
so much more than that.
than sitting in a corner and crying. It is
Right.
so much more than that. Please understand that.
Yes. So we've talked about a lot of ways that we talked about trying to get pregnant, getting pregnant, and what can happen after pregnancy. But there is, a conversation that needs to be had for what could be a barrier to actual pregnancy. And we talk about this a lot. There's a lot of socioeconomic disparities that can prevent certain people from getting pregnant. A lot of times this is low income and people, women of color that experience these issues more over than their counterparts. And it's like access to healthcare, just basic transportation to get to their appointments, the financial aspect of having a child, and then postpartum childcare. That's a big thing. It's a big thing. Trust me. Even us folks that have, a good job have had some issues with childcare and the cost of childcare. Okay.
Right.
Fertility and infertility. Again, one of these taboo things.
You don't talk about that.
We do not talk about. And I will say, though, let me say this. I will say that even in the more affluent African American communities, you would think that this conversation is had at a broader level. Everybody's talking about it. And a lot of times we still don't. There's still financial barriers for people to get pregnant.
Part.
Even
that was the defining factor for us.
Yes. Even with the proper health care and the good job and the access to transportation, there's still a financial aspect of it that could be a barrier to a lot of women from getting pregnant. We experience infertility at high rates. And I think that, well, not at high rates, but at higher rates sometimes than our counterparts. So you're going to want to talk to your doctor early about your fertility. This is something I wish somebody set me down and talk to me about. You're going to want to push for the right test. If you don't know what to ask, I'm going to tell you. You can use the TUSHI acronym that was developed by Amy Avazadeh. I don't know. Sorry if I butchered your last name. She's an MD and a reproductive endocrinologist. She came up with this acronym. So, are your fallopian tubes blocked? That was one of my issues. So, a tubal blockage could be a full blockage of the fallopian tubes. It can happen from previous infections, ectopic pregnancies, tubal ligations. For me, it was the PCOS, polycystic ovary syndrome. For some women, it's endometriosis, and that's like at the scar tissue that can happen around the ovaries or the tubes.
It just makes everything stick together.
Yes. So if you're thinking about, well, how do I know if my tubes are blocked? Well, there is a test, a HSG test. It's an x-ray procedure that they use to look at your uterus and your fallopian tubes. They inject liquid dye into your vagina, and it will determine whether there's a blockage. I'm going to tell you, this is the most painful experience that I've ever had. I even had a doctor tell me that they should have that they think that they should sedate women who have this.
Aren't they supposed to? Because they were supposed to sedate me.
No, they don't sedate. And when I tell you, I almost passed out. I got so hot. I screamed bloody murder. They had to put a hot rag on me because it was just painful. It was like the worst experience. And I think the more blockage you have, the worse pain that you are going to experience. I'm just putting that out there, okay, for you all to have that information and do it with it what you can. Does the ultrasound reveal anything? Okay, you get a transvaginal ultrasound. It can detect uterine fibroids. Anyway. You should. It should just be standard.
That helps with. It should be standard because they would always do the regular ultrasound for me to detect my cysts. It would never show anything. It just made me had to pee all day.
Yeah.
So, like, the transvaginal one I think they should start out with that because that's when they could tell where the cysts
I think they should.
Where
right.
the adhesions are.
Yep.
That's my standard go-to. Like, if when I had a womb. But you know what I'm saying.
Right.
That was normal.
And we're not medical experts. We're just speaking from our own personal experiences.
Right.
Here's one. We always want to talk about what the women's issues are when it comes to having children. But has your partner's sperm been tested?
Right.
A key thing. their sperm
Right.
survival. You know, it's not always on the woman, even with a normal count. Sometimes there is a the woman's cervical mucus may prevent, you know,
Him getting to
sperm's
his goal.
survival. Right.
Yeah. Take 'em out.
Yeah. Sperm factors, low count, lazy swimmers, poor shaped I didn't even know this is a thing. Poor shaped sperm. Immune problems, right? That can have an effect on whether or not they can have children. And even if they've already had children, it can happen. You could be with somebody who had a child at 25 and now they're 35 trying to have a child with you and their sperm has changed. So don't let no man tell you, well, I already had kids. Okay, but I still need you to get your sperm checked.
Thank you. Please
I don't care if you
thank
had 5 kids before me. I still need you to get your sperm checked, okay?
Please and thank you.
How are your hormone levels? Key. Because your hormone levels can have problems and create problems with your ovulation, right? We're not good ovulators because of some of the hormone imbalances that we have going on. So you can get a blood test to check your levels of follic stimulating hormones. That triggers your ovaries to release an egg each month. You can take a urine test for what is this? Luteinizing hormone.
Luteinizing.
Yeah. This hormone shows up in high levels just before you ovulate.
Yep.
You want to check your progesterone levels in your blood because increased progesterone shows that you're ovulating. You want to look at your genetic profile. Okay. That's what you got going on in you, what your partner has going on in them. So you can make the determination if there are underlying factors that may keep you from getting pregnant.
Correct.
Age sometimes is a barrier, right? They tell you all the time, oh, 35 is the marker. As soon as you hit 35, things start to go downhill. But it really is your ovary reserve that you really need to pay attention to, right? Because the ovary reserve is is what is key to determine whether or not you're going to be able to conceive, because that's the number of eggs you were born with. Now, you could be 25 with a low ovarian reserve or diminished ovarian reserve. And so that means that your eggs are lower in number or quality than is expected, right? Now, they say your prime reproductive years are typically between your late teens and late 20s, which you're like, God damn, ain't nobody trying to have kids. You know, I was not trying to have no kids in my late teens, early 20s. And so as you get older, that window gets smaller and smaller and smaller. And then the quality of your eggs gets smaller and smaller. And then your ability to get pregnant will start to decrease. Now, when I did my testing, they told me I had the ovarian, and I got tested at 39. They told me that or was it 40? No, I had Charlie at 40. I don't know. I was 39 when I got tested. They told me my ovarian reserve was of a woman in her early 30s. So I was still good, but I had other issues that were preventing me from getting pregnant. So I strongly suggest and urge, if you are someone who's thinking of getting pregnant and you're still in that before 35 time frame, see if you can get your ovarian reserve checked out.
So important.
It's very important. And this is my own personal one that I said is a barrier. Length of time trying. The doctor will tell you, oh, don't worry about it until you've been trying for X amount of time. Bump that, screw that, F that. Because they tell you before 35, you should at least try for a year. And after 35, I think it's 6 months. And then after like 40, it's like, what are you doing, sis? But I say, you know your body. Yeah. Because sometimes waiting a year is the difference between getting pregnant and not getting pregnant, in my opinion. In my opinion. So I say, get your reproductive fertility, all that stuff checked out ahead of time so that you know what you're working with. Because if you're young enough, you can get your eggs freeze if you can afford it.
If you can afford it.
Or you can.
Not cheap.
Right. Or you can create a plan on how you're going to get pregnant in the future. But I'm just telling you, I think that this is important, and I don't understand why this isn't pushed more. I mean, I understand why. There's the money in. Yeah. There's money in the medicine, right? It's not. Always. There's not money in helping you fix it.
In the cure.
It's in the treatment. So of course I'm just gonna make you wait so I can push you to get IVF. And I'm going to tell you this last thing before we start to wrap things up. When I went and I'm just saying this for anybody who may be experiencing this. When I went and got, my test done, and I was told I had a blocked tube, the doctor said, just go for IVF. And I was like, well, what is the step before IVF? Oh, well, you can try to get your tube unblocked, but I wouldn't suggest that because that's usually not successful. And it's just an unnecessary step when you're just going to be right here at IVF. I said, okay. What did I do? Can you give me any referrals of people who can unblock tubes, please? Thank you. He did. I got the procedure done. I have my child. I'm just saying, don't let them just throw IVF down your throat.
Because they will. They did that with me when I went in to the fertility center to figure out, because I had endometriosis.
Yeah.
You definitely, and I have adenomyosis, and I had fibroids. They were like, so there's really no reason for us to do the little dye test, even though we were prepping you because you have too much adhesions, too much scar tissue. So we're pretty much, you just need to go on and try IVF.
Yeah,
first.
That's what they'll push.
And I was like, okay, we're about to build a house. It just wasn't, the timing was just not there.
Right.
Like, yeah, you can try for like another couple months, but you probably won't get pregnant. So I was like, okay. Yeah. And they did tell me I was 37 at the time. They told me I had one more year to use my eggs. And this is kind of part of the different pathways. They had told me I had one more year to use my eggs that I had in reserve. But once I hit 39, I would have to get donor eggs because my eggs were no longer viable after a certain age because of all the other health and reproductive issues that I had to that point. So just make sure you explore all those options because at that point, they were like, you can't have kids. So, and talk to whoever you need to talk to as much and do your research is so important because if those things aren't available, then you're going to have to look at or think about other ways to become other pathways to motherhood. Being a surrogate is one. My sister offered to be a surrogate for me, but that still is there's a whole bunch of other stuff that's involved with that. Freezing your eggs, like we talked about, that can be $8,000 to $15,000. And you got to think about a plan to look into when do you want to start thinking about that. If you're in the type of career that it's a long-term type career, start stocking that money. I think there should be some sort of financial plan for if you want to save your eggs. Just like if you want to build a house or save a house or get a car, there should be an egg fund. And
I think there are some organizations that may assist people with getting financial assistance with helping them freeze
as well. Yeah, there's a soror of ours that works at an egg donor place. So we'll be sure to also include that information. And then sperm donation. I have another friend who has gone this route, and she has decided to do sperm donation and hasn't waited for a partner because she's in a particular age group and has other health concerns. So she's doing this in that way, as far as using it as a way to become a mom. And then there's my path as a bonus mom because my husband has children. Then I don't use the term stepkids. I just think bonus mom is better, personally. And then whatever may come with that and your emotions. And that's something to also take into account, too, because if you're a person that cannot have children and then you are kind of put in a situation where you have grown children, it's a good and a bad thing because you kind of see them later and you don't go through some of the stuff that a lot of other women complain about or stress about. But then you're also coming in on the tail end of trying to be a bonus mom when there's another mom involved. And then the dynamics of that, and it's a lot. There's a lot of emotions and stress that come with being that you don't think about because, I have other kids now, or I claim them as my own or something like that. So those are conversations like with those of us in the neighborhood. There's half, like you said, Zarifa, that have the little babies between 0 and 3. Then there's other ones that have the 8 to 15, and then there's the rest of us that have hysterectomies and have bonus kids. Mm-hmm. And we all have our respective groups that come with that, and how we have to talk about how you discipline and how you adopt them, or if you don't adopt them, are you going to think about foster care if you can't have kids? So there's other ways that you don't physically have to birth children to be a mom. And I just want to make sure that we all, remember that, because a lot of women feel like if I can't birth, I know I did at some point, because I couldn't carry a child to term because I wasn't able to get pregnant. It makes you question your viability as a mom, or somebody calling you mom, and the mental health concerns that come along with that as well, because it's coupled with infertility, it's coupled with cost, there's so many things you got to think about, so that you, as moms, whatever way that presents itself, to make sure that you take that in, and appreciate those that are in your circle. If there's infertility groups that you can talk to, there's Fertility for Colored Girls, the Cade Foundation, Oshun Fertility, and then other organizations that help with just being a Black mom: National Birth Equity Collaborative, Black Mamas Matter Alliance, and the Black Maternal Health Caucus. So all of those things are also support groups to help you navigate these journeys, this journey of becoming a mother, as we've kind of laid out to this point. So, with that, I don't know, Z, you have anything else you want to touch on with that?
I just want to, preface and say again, like Natalie said, that was a key thing that I think I want to just stress is, like, everybody's journey to motherhood is going to be different. And we're just providing information for the most talked about way, the most talked about journey to motherhood, and just try to alleviate some of the stigma that's attached to how, we're treated. Alleviate some of the stigma, circling around how we get pregnant, what happens during our pregnancy, what happens after pregnancy, and even support those who may not be able to get pregnant, but still have the different path to get to motherhood, which is just as beautiful and just as important.
Yes.
So we can go ahead and take a quick break and come back with our last sip of the day. And we're back. This is the last sip of tea with your Hood Dalai Lama, and I'm your Hood Dalai Lama. We need to do a better job of putting ourselves higher on our own to-do list, and that is attributed to our forever First Lady, Michelle Obama. And look, if I could tell, Black women, women of color, women, period, anything, it's just going to be listen to your body. We advocate here for you, and we would like for you to advocate for your health. And we may all run into struggles. And if you do run into a struggle trying to get to that end game, which is motherhood, don't give up. There are a host of other ways that you could be a mom. And, we know IVF, egg freezing, surrogacy, adoption, foster care, being a bonus mom, getting pregnant. It can all sound overwhelming and expensive, but there are always options. And this journey into motherhood is beautiful. It's exhausting. It's scary. It's bewildering. But however you get there, just enjoy the ride. And that is the last sip of tea with your Hood Dalai Lama.
Thank you. So, thank you all for joining us this week on Sippin' Tea with Nat and Z. You can follow us on Instagram at Sippin' Tea Nat and Z _pod, and on Facebook at Sippin' Tea Nat and Z to get information on upcoming podcasts, guest news. Thanks for listening. See you next episode, where we're going to spring into spring cleaning and help declutter your mess. Thanks all.
Bye.